Hello, a lot of people of the world.
Magandang araw sa inyo lahat.
안녕하세요, 여러분.
Ahlan wa sahlan.
This is Justin and Sarah, and Sabrina is sleeping.
She just moved.
This video is about postpartum update for first 20 days. And if you're interested in purchasing our Love Withstanding t-shirt, the link to where you can purchase it is in the description below.
Today is February 5th, 2019. I'm officially 20 days postpartum today. On the day of Sabrina's birth, she had a bit of jaundice, which is the yellowish discoloration of the skin and the white area of the eyes as well. They said that it's normal for most babies to have a little bit of jaundice.
Especially for Asian babies, it's okay to be yellow.
Right? They had to keep us at the hospital for 36 hours postpartum just to make sure that everything's okay with her, that her jaundice levels don't rise. The very first time she was born, they checked for her jaundice level. Her first result was right beneath the yellow zone, which means she's on the green zone but close to the borderline. So they said, just to make sure, they had to recheck, make sure it did not go up, because for most babies, the jaundice levels tend to go up. Especially within the 72 to 96 hour mark. So then they kept rechecking her within the 36 hours that we stayed at the hospital. But she was at our bedside. It's not like they took her to the NICU or anything for that, because she was still within the normal level. They said that they noticed that there was a bit of a spike from the green zone to the yellow zone. At this point, it was to the yellow zone, and then they said that they would have to refer us to a public health nurse within a 24-hour period from going home to make sure that her jaundice level does not go up to the red zone, because once it reaches the red zone, she's going to need phototherapy or light treatment to treat her jaundice.
While we were in the hospital, it was closer to the lower spectrum of the yellow zone. When we went to public health nurse, it was closer to the red zone. It was still within yellow zone, but closer to red than it was closer to green.
Based on our observation, it seemed like Sabrina had jaundice or at least slight jaundice for about 4 to 5 days since birth, because I could tell that the yellow discoloration in her eye was starting to fade by day 5. So
what I noticed mostly is the color of her poop. Initially, she was pooping out dark black-green poop, and on the 4th or 5th day, she was pooping out pure yellow poop. It looked like a yellow curry.
That's why while Sabrina was with us postpartum at the hospital, they were encouraging that we feed her more and more of the colostrum that I had saved. I had saved so much colostrum, apparently more than they said they have ever seen in a while. They commended us for it. They were like, oh, great job. So that was easy for us. I didn't need to breastfeed her all night long while I was staying at the hospital. All I had to do was was to give her the colostrum that we had in syringes.
Somebody on the YouTube asked what we are doing with syringes there in the photo. That's us feeding Sabrina colostrum through a syringe with pinky finger inside her mouth to imitate
the nipple or the breast, right? So at least it's skin. The pinky finger feels like the nipple a little bit. When we came home with Sabrina, I could not sleep still. I couldn't sleep at the hospital, I couldn't sleep at home. I believe I couldn't sleep for 5 days postpartum. It's just adrenaline rush, the hormones, I guess. I was just so excited. I kept checking on her breathing. I kept feeding her. Days 1 through 3, she was feeding every hour. So I was like, I just have to feed her, because they said that's usually with the treatment when it comes to early signs of jaundice, was to feed her as much as possible so that she could poop as much as possible and poop as much of the yellow substance in her body, which is the bilirubin, poop as much of that out. That's why her poop started off blackish green and then all of a sudden transitioned to yellow. So that's good. Also, the next thing that they had to keep us in the hospital for was that her blood sugar level at birth was a little bit on the low side. So they had to make sure that we continue to feed her as much as possible to keep her blood sugar level up. So they kept checking on us every few hours. Checking on her every few hours to make sure blood sugar levels stabilize. And they did. I think the very first result upon birth was low, but after that, it stabilized, right? And same thing with her temperature. So her body temperature was a little bit on I think, borderline low. So they had to make sure that her temperature remained, stable towards before they discharge us. So yeah, thankfully, again, everything stabilized. She's perfectly healthy. So they were confident in sending us home within the 36-hour period. We were ready to go home, but at the same time, a part of me was scared because I'm like, oh my God, there's not going to be any nurse or doctor at home that we could ask for help.
There's always 811 hotline that you can call, or
Right.
public nurse.
These are the first 2 weeks of her birth that there's an actual direct line. Oh my goodness. The healthcare team at the Foothills Medical Center, you guys, and also the Riley Park Maternity Clinic, they are just amazing. We got so lucky. Oh, and a bunch of you were wondering whether it was midwives, but we weren't dealing with midwives at the hospital. They were nurses and doctors.
They're all either RNs, registered nurse, or
Yes.
they're doctors.
Yeah.
We had no midwives in that room.
I mean, you guys do what's more comfortable for you, obviously, when it comes to labor and delivery, but for me, I felt more comfortable being at a hospital setting.
The baby came out 6 pounds and 2 ounces, and within 12 hours, her weight went down to 5 pounds and 8 ounces.
Which they say is normal for most babies to lose weight.
By day 3, she was at 5 pounds and 13 ounces. Day 4, she was at 6 pounds and 1 ounce already. 1 week after the birth, she was at 6 pounds and 8 ounces.
Yeah, our OB was very, very impressed. She was like, oh my goodness, she gained all her birth weight and some in a week. Which they say commonly babies regain their birth weight within the first 14 days. Yay! So we did great, basically. They were commending us for feeding her as much as we could. I just made sure every time she looked hungry, like every time she had a rooting reflex or had her hand to her mouth. She does a little bit of a pant when she's hungry, like like that. So whenever he hears that, he's like, honey, she's hungry. Yeah, Justin was such a trooper. He helped me so much, inserting his pinky finger in her mouth and giving her as much colostrum as possible. We tried to use up all our colostrums. I believe there's only 2 syringes left in our freezer, because when you keep your colostrum in the freezer, it's good for 6 months. So we're keeping it in the freezer in case we need it, like when she gets sick or a fever, develops a fever or whatnot after getting vaccination on month 3 and month 5 since birth. Oh, and at the public health nurse follow-up, they were teaching me how to breastfeed properly, how to make sure that she latches on to my breast properly. It was a big eye-opener for me because I'm like, I've never breastfed before. I mean, I've seen videos, but I didn't actually learn the proper way to latch. It's different when you actually apply it in real life. So yeah, they were teaching me about everything I needed to know, which is to make sure that she has a nice wide open mouth before the latch happens, and make sure that her chin or her lower jaw makes contact first onto your nipple before the rest of her mouth. So I thought I was doing breastfeeding properly, but apparently I wasn't, because there were 2 days where I could not breastfeed her at all. The 2 days my nipples got all blistered. The left one was even bleeding. I was worried for her. I didn't want to feed her blood, even though it's my blood. So at that point, for 2 days, Justin helped me out by giving her expressed breast milk. I had to pump for those 2 days, and he was just giving her breast milk through his pinky and a syringe. I didn't feel comfortable introducing the bottle to her just yet. I only used my own breast milk over my nipples, my blistered nipples, to help them heal. And by the end of 2nd day of that rest period, thankfully it felt a lot better. I would say that her latch is a lot better thanks to the public health nurses here. Her latch is a lot better, but I also noticed that my nipples, ever since they got blistered, became tougher. TMI! So they became tougher in the sense they could endure more of her sucking. Like, it's not as sensitive. It didn't hurt as much anymore. In fact, it became very comforting for me, because that's what the public health nurses were saying. I was like, breastfeeding is supposed to be comfortable for you and for her. Not just comfortable for her, but painful for you. It's not supposed to be painful. And yeah, I had to make sure that every time that she was hurting me, to detach her suctioning and then have her relatch as often as I needed to until she got it right. So yeah, it was kind of funny, I guess, for Justin to see me go like, open wide, nope, do that again, oh, you're hurting mom, do that again, right? But yeah, it's amazing because she knows exactly when to open her mouth wide. Like she can tell when I'm pulling out, she's like, okay, fine, I'll open wider this time. Yeah, Sabrina's a really smart girl. I like to think she's really smart. Yeah, you know, we're biased. We love our baby, so we're biased. To us, she's perfect in every way, in every sense of the word. You guys probably saw the day that we came home. It was kind of big, and I was kind of like, it was boggy, it was soft and squishy. I was like, oh, this is so weird. I felt like I was still carrying another baby, but not as heavy. So I was like, oh, I thought that most of the fat on the belly or most of the bump was her, but it was surprising for me to see that my belly did not go back to its normal size right away, at least not within the first 24 hours. Oh, and also the day that we came home, that's the first time I noticed that my feet were swollen postpartum. So I was like, what happened? Like they were puffy and looked balloony, and my lower legs was kind of puffy as well. I was like, oh, that's strange. Part of our follow-up with the public health nurse, she recommended that I raise my feet like whenever I breastfeed. The good news is within 4 or 5 days postpartum, my feet went back to their normal size. The swelling subsided, so yay, right? And if you guys remember, in my past videos I mentioned I had an itchy rash that was developing on my lower abdomen, spreading onto my waist or onto my hips a little bit. I noticed that it was still itchy. Even though baby's already born, I was like, oh my goodness, I thought this was gonna go away after I give birth, but no, still itchy. Started to spread onto my upper thighs. So I mentioned that concern to my OB 1 week after Sabrina's birth, and she was like, oh, you know, you never mentioned that to me before. And I was like, oh, I could swear I mentioned it to you. And I realized I mentioned it to a different doctor. Oh, give me her. She's crying. What happened?
This is how she cries.
It's okay, baby. We're just talking. We're talking to our YouTube family. Oh, no, honey. What's wrong? Shh. It's okay. Okay, just relax.
Do you need to feed her?
No, sometimes she wakes up like that, crying. Papa Bear here is gonna take care of her while I keep on talking. So she prescribed me a steroid cream or ointment that I could use and apply onto my belly and all the rashy areas. And sure enough, yeah, the rash is subsiding. It's no longer itchy. It hasn't been itchy since the 4th day that I've used it. So that's great, thank goodness. But yeah, you could still see a little bit of discoloration in my skin. So the rash has not completely gone away. I mean, but it's starting to fade, so that's great. So remember how I mentioned my belly was still big in the first 24 hours postpartum? By day 10, I would say. Well, Justin's gonna post pictures here of my belly 1 week postpartum and 2 weeks postpartum. So yeah, it did eventually go down. I would say within day 10, I noticed that there was a significant change in my belly. I was losing a lot of weight everywhere else as well. Like I started to see my waist more. My legs are skinnier. I was like, oh my god, just making faces. Go closer, go closer. She's like, really, Mom? Look at that face. She's like, what? Is that so? You lost all the weight by day 10? Oh my goodness. Mama, you never told me. So cute. Love you, baby girl. Because I lost a lot of the weight on my belly, I noticed there was loose skin hanging on the belly there. Not a lot, but it is looser, not as toned as pre-pregnancy, right? But then at the same time, it's not like I had the flattest belly ever out there. It's just that it was, of course, a little bit tighter than it is right now. So the stretch marks are not as obvious.
They're very superficial. It's not deep trenches, and they're very short.
This is my belly, day 20. And I see some scarring from the rashes that I had before. I mean, during and after pregnancy there. And then there's loose skin. Is it focusing? The linea nigra is still there. That far. You'll see a difference in my skin color between here and here. So yeah, stretch marks, a little bit, not that visible. I don't know if you could see. Those are my warrior marks, so yay! So my private part, my vagina. I'm gonna talk about my vagina, you guys. So my vagina was still sore and some pressure was still there when I came home, obviously. It was hard for me to sit down properly or to sit down for long periods of time for that matter. But I noticed by the 7th or 9th day, I didn't feel as sore down there anymore, which is great. I was too scared to look down, I still am, to look down there to see what it looks like using a mirror, but I can sort of feel it when I wash myself down there, obviously. Started to have the courage to feel and notice stitches. By day 4, I noticed this, I could feel the stitches with my fingers, but then by day 8, I noticed that the stitching already dissolved, a little, most of it dissolved, because I could only feel skin and a little bit of the bump of where the stitches used to be. So yeah. It's amazing. I was like, oh my goodness, I'm healing fast as far as I know, because time is just flying by, but I felt like I'm healing fast. Thanks to all your prayers, well wishes, love, and support, I had such a smooth pregnancy, and also I couldn't ask for a better labor and delivery experience. Honestly, I mean, look what I got out of it. Look what we got out of it. I still can't believe we made her. I can't believe we made her. Oh. Day 19, which is yesterday, I noticed I could wear a panty liner. I'm no longer wearing period pads or sanitary pads. I could wear a panty liner and get away with changing it only twice. Changing it once. So wearing 2 panty liners a day was enough to contain whatever discharge is coming out. It's still, the color of my discharge as of day 20 today is more on the pinkish side, no longer red, pinkish and brown. Yeah, definitely. So it's almost as if the bleeding is reaching its end, but it's expected, they're saying it's expected that I continue to bleed or have discharge up until 6 weeks postpartum. So it's supposed to change color from red to pink to brown to yellow to white is what they said. So for my belly, Justin here purchased postpartum waist belt from Amazon, and that's what I've been using to help maintain shape of my tummy and also to help my uterus go back to its pre-pregnancy size. I know. What are you dreaming about, my love? So sweet. Oh, sometimes she laughs in her sleep, or she does get hungry every 2 to 3 hours, you guys. I'm like up all night, not up all night. It's like by the time I'm done feeding her and changing her diaper and putting her back to bed, an hour has passed. So it's like she'll be awake the next hour from now. So yeah.
I think we should start training her to bottle feed. At this point, if you try to bottle feed her, after you pump the milk, she tends to push the bottle out with her tongue. We can't drop her off at mother-in-law or your mom's place.
But it's too early, honey.
Because Valentine's Day is coming and we can't do anything because we're just stuck
We
there.
will. Well, it's not like we can do anything on Valentine's Day because mom and my sister will not be home from vacation.
So no more movie nights, we can't go anywhere.
We can.
Because we can't drop her off at anywhere.
Okay, you guys. So her umbilical cord stump, whatever's left of the clamped umbilical cord, came off or fell off on day 8. We kind of made a mistake of giving her a first bath before that. Her belly button stump has been bleeding, and there's been like not bleeding, I don't know, there's like a bit of discharge and dried blood, so I had to make sure I cleaned that out. Our OB and family doctor's not concerned. They said, oh, that's normal. Things are just starting to heal underneath that stump. All I did was use a Q-tip, warm water, and clean and dry out her stump and belly button area twice a day until finally her belly button looks like a belly button. The dried blood and crust and all that came off of her belly button stump. So that's great. She now has an outie for a belly button. Super cute. Okay, so that's all I've got for postpartum update.
We'll talk about my parents and Sarah's dad in another video.
Yep.
Since most of you or many of you guys have been asking.
We will talk more in detail about that in our next few videos that come out, I guess. A lot of you guys were wondering what Sabrina's middle names are and whether she has been given a Korean name by us officially in her official documents. So what's her name, honey?
So her first name is Sabrina. Her middle name is Ray. And her second middle name is Seong-mi.
Seong-mi. And last name?
Park.
Yes. So we decided to go with Seong-mi because it means beautiful star in Korean. And also we felt it was important that she has a Korean name. Because, I mean, she's mostly Korean anyway. She's 50% Korean, only a quarter Sudanese and a quarter Filipino. And yeah, that way when she ever goes back to Korea, she would have a Korean name. And it'll be official.
We decided to go with Seong-mi instead of any of the names that my dad had suggested because I didn't like any of the names that my dad suggested. So we came up with our own name. I had to look up Korean dictionary to find the meanings of different words and then settled into name Seong-mi.
Plus she's our beautiful star.
She's
To
a beautiful
us, she's our beautiful star. And yeah.
You guys know the Korean electronic brand called Samsung? That song is the same song meaning star. Samsung means 3 stars. Sam is 3, Song is star. So she has that in common.
Seong-mi. Oh, I love it. She's making weird noises right now. I think she's trying to escape her straitjacket. Just kidding. Her swaddle. So yeah, tune in on Instagram and Facebook because
or YouTube.
As we're getting our maternity and newborn photos released slowly at a time because our photographer
Megan Page.
Yes, you have to check her out, you guys. She is amazing, especially if you live in Calgary. She is an expert, like such a professional when it comes to maternity, newborn, family portraits, anything baby related or family related. She's your gal. We're gonna move on to shoutouts. Shoutouts. Shoutouts.
I always mispronounce it and say shoutouts.
Yeah, buddy. I'm gonna go get gifts now. Hey guys, so we got this awesome snake-like, oh, it's upside down. Oh, I guess not. Snake-like car seat toy that twirls around the handle of a car seat to keep Sabrina busy. I don't know if you could see. So cute, you guys. 2 gifts in one. So that's the one gift. And then the second gift is a whole bunch of, what are these? A 7-pack flannel receiving blanket. Oh my goodness, from Carter's. OMG. Check that out, you guys. That's a lot of receiving blankets. So exciting. So basically, these 2 gifts were from Stephanie Drain. It says here on her gift note from Amazon, congratulations, enjoy your gift from Stephanie. And then the other one says, congratulations on Sabrina's arrival. Wishing you much love and joy. Enjoy your gift from Stephanie. Thank you, Stephanie, for your wonderful gifts.
Thank you, Stephanie. And Sabrina says thank you too.
Sabrina says thank you. She's going to give you kisses. Kisses. Mwah. Okay, here you go. So we got a gift from our friend Karen. She got us a pacifier from Bright Stars, from Toys R Us. The brand name's Bright Stars. And she got us this awesome fuzzy gray blankie that we could use as backdrop for Sabrina to lay on whenever we give her like an outfit of the day kind of image. Thank you, Karen and Alex and Mila and Ethan. That's all we got for shoutouts.
Thanks for watching. And remember to like, subscribe, comment, and share. From Justin, Sarah, and Sabrina.
Oh, and we'd like to thank all of you guys out there who have given us well wishes, your congratulations, all the love, support, and prayers that we are getting from you guys. Thank you so much. You guys make every second of our editing and filming worth it. We try our best to make you guys happy because you make us really happy and feel overwhelmed with love and joy. So thank you so much. We love you and we appreciate every single one of you guys. We love you. Sabrina says thank you. Love you. Look at the chubby cheeks. Oh, chubby cheeks. Oh, do, do, do. We love her so much, and I'm sure Sabrina sends her love and kisses and hugs to every single one of you out there. Thank you so much.
All right, thanks everyone. Bye.